Increase in peritoneal fluid, also known as ascites fluid. The fluid made in the abdominal cavity that lubricates the surface of tissues that lines the abdominal wall and pelvic cavity is called peritoneal fluid. An increased volume of peritoneal fluid is called ascites. The image to the right depicts a healthy person with no fluid accumulation in the peritoneal cavity. The person to the right, however, has a considerable amount of ascites fluid in the peritoneal cavity, causing the abdomen to become swollen. Signs and symptoms of ascites include abdominal pain and bloating, shortness of breath, and liver failure. Other symptoms include shortness of breath, nausea, swelling in legs and ankles, indigestion, vomiting, heartburn, loss of appetite, fever, and hernias. Ascites happens when pressure builds up in the veins of the liver and it doesn't work as it should. Ascites is caused by a variety of diseases and conditions. For example, cirrhosis of the liver, cancer within the abdomen, congestive heart failure, and tuberculosis. Bacterial infections such as peritonitis that are caused by intestinal perforation or a ruptured appendix is also a frequent cause. Malignancy is another cause for ascites accumulation. Most theories suggest that an increased pressure in the liver blood flows to the liver, and a decrease in albumin, which is a protein that is carried in the blood, may be responsible in forming the pressure gradient and resulting in abdominal ascites. Diagnosing the cause of ascites. A doctor or other healthcare professional will examine around the belly to determine how much fluid is in the peritoneal cavity. Your doctor may have kidney and liver function test examples, electrolytes collecting urine for 24 hours, and tests to measure bleeding in abdominal ultrasound. Paracentesis. If the doctor thinks the patient has ascites, he or she will use a needle to remove fluid from the abdomen for testing. This procedure is called paracentesis. The ascites fluid can be examined for the presence of malignant cells, which can be important in the detection of tumors. Those malignancies are usually of gastrointestinal, prostate, or ovarian origin. It can also be tested for infections, pancreatic disorders, inflammations, and for microorganisms. The video demonstrates how the procedure is performed.
A curved array transducer with an abdomen exam type is used to perform an ultrasound-guided paracentesis. It is easier to perform this exam when the bladder is not filled. The patient is placed in a supine position. The abdominal cavity is evaluated in two planes. Place the transducer in a transverse position with the orientation marker to the right. The transducer is placed at the lateral border of the rectus sheath at the level of the umbilicus. To evaluate the abdominal cavity for free fluid, sweep the transducer from an inferior to superior position. Fluid will appear hypoechoic or anechoic and accumulate in the lateral gutter and between loops of bowel. To obtain a long axis view, rotate the transducer 90 degrees with the orientation marker directed to the point of needle entry. Sweep the transducer across the abdominal cavity from left to right to evaluate the abdomen for free fluid. A needle insertion site should be chosen in the lateral abdominal area in a dependent area of the fluid collection, which is clear from loops of bowel. The needle should be inserted lateral to the rectus sheath in a transverse fashion to avoid the epigastric artery. Follow the needle entry by slowly sliding the transducer in the direction of needle advancement. The needle will appear as a small bright hyperechoic dot. When the needle tip appears, the transducer should be advanced a short distance distally to follow the tip of the needle trajectory. The needle is slowly advanced under direct ultrasound visualization until the tip is seen to indent and then puncture the parietal peritoneum. The transducer should be moved slightly proximally and distally to confirm location of the needle tip.
Treatment. Depending on the cause of ascites, treatment will vary. If cirrhosis is the cause, a doctor may prescribe water pills, which are also called diuretics, to help flush the extra fluids from the body. In severe cases, a liver transplant is necessary. Other treatments include paracentesis, which relieves abdominal pressure, and if cancer is the cause, shunts may be used to move the fluid from the abdomen to the bloodstream. Chemotherapy also helps control cancer and can be administered through a tube in the abdomen, which can sometimes stop fluid buildup. The diuretics help remove water and sodium from the kidneys.